Good afternoon, everybody, and welcome to UNIV 391 COVID-19, the Mason Impact course for tonight. We are at the end of our fourth week. And again, as I say, every time we join together, this has been such an interesting class, partly because what we thought we knew in the beginning is very different than what we're facing today. And part of what we're going to be talking about today is how do you deal with the uncertainty of not knowing about things and maintaining your sanity in the process of that. So before we get started with our presenters today, I have a couple of announcements for you. A reminder that this week's assignments are due on Saturday at midnight rather than Friday at midnight. I want to say Eid Mubarak to everybody who is celebrating, and so we're moving it so that we are not hitting the religious holiday on Friday. Next week, we have two sessions, only Monday and Tuesday. Tuesday is the last day of class. Monday, we're going to talk about the modeling, even the modeling at Mason for being able to be able to look at how what kind of planning we needed to do. And then Tuesday is going to be our return to campus planning with the university physician and the campus planner. And we will, at the end of that one, have an extended question and answer session for you so that we can answer those last questions. That means you've got 3 more responses, the one today and the ones for the next 2. I actually really want to encourage you to make sure that you do that last one, because that's a wrap-up question that brings together what you've been hearing about through the whole semester and thinking about how your own behavior and beliefs have been changed by the class and how you'll be safely returning to learning in the fall. So I am excited about all that. I'm impressed by the work that y'all are doing and want to make sure that you get a chance to be able to do all the responses. A reminder that you need at least 9 satisfactory responses over the course of the course to be able to get a satisfactory grade in the class. So you should see how many you have now. Over 10 also gets you a badge for doing great work. So with that, I am really happy to introduce 2 of my friends and 2 of the people that I think are doing really fabulous work here at Mason in a really timely conversation. Robyn Mehlenbeck is the director of the Mason Center for Psychological Services, and she's a clinical faculty member in the Department of Psychology. Robyn and I have worked together for years, but we were actually in a leadership development program together probably 7 years ago, Robyn?
At least.
And so I don't get to see her often enough, and I'm thrilled that she's joined us today. Keith Renshaw is professor and he's chair of the Department of Psychology, and he and I work closely together too. He was actually chair of our faculty senate and is a really fabulous faculty member who's been working on developing courses both in person and online, and is a real advocate for students being directly involved in research. So we are lucky to have them both here, and the work they've been doing right now to be able to address the mental health issues that come with COVID and the response to COVID are really timely, and I think will probably resonate a lot with y'all as students. Quick reminder, the chat is for direct questions to the TAs about the class, and the Q&A box, I want you to be actively asking questions in there because I expect this is going to be a really interesting topic for you. So remember to ask questions and to be able to vote up questions that you want to see the answer to too. So with that, Dr. Mehlenbeck and Dr. Renshaw, I turn it over to you.
Thanks very much, Bethany. And I'm going to pop this up and share the screen. Since you guys already got a brief intro, my name's Keith Renshaw, and I am the chair of the psych department. And my research really focuses on how people respond to stress and trauma, both sort of individually and interpersonally, sort of how their relationships impact their response and how their response impacts their relationships. And I've done a lot of work on that in relation to military couples, but then also other stressors. And so I've done some work that I'll tell you about in a couple minutes here with COVID. And then I'm joined by Robyn Mehlenbeck, so I'll turn it over to her for a couple minutes here.
Hi, so again, you've already did a very kind introduction, Bethany. I just want to highlight that the Center for Psychological Services is actually the main training clinic for the doctoral students in clinical psychology, and we serve the community. We actually function as a community mental health center separate from Mason's Counseling Center, and I'll talk more about that a little bit later. as well. But my research interest is actually in helping overweight teens and kids lose weight, particularly currently in minority populations. But I love my role as the center director and helping really train people and get some hands-on experience, including undergrads. So I'll talk about that towards the end as well.
So, before we jump in, we're going to just ground this in a little bit of, the current situation. And you guys have been talking about this for weeks, so you're familiar. But, there are various ways to think about 2020 at this point. We've shared a few of our favorites. For a lot of us, probably we're sort of thinking, when does next year start? Can we get there already? But how we're all sort of navigating and sort of making our way through this is it really tells us a lot sort of about human nature and about how difficult things like this can be. And it really highlights the impact of what happens when not only your daily life is disrupted, but also your daily connections are disrupted. And so move forward here, and Robyn, turn over to you for a couple here.
Yeah, so this is one of my favorite infographics because every day I think every one of us needs to really think about how are you going to get through the day. And so this suggests, who do I choose to be during the COVID-19? First of all, it gives you a little bit of control if you have some idea that you have some control within this time of uncertainty. We were joking a little bit before we started tonight that, every day brings something different. And so how do you cope with that uncertainty? And this highlights the fear zone, the learning zone, and the growth zone, and gives you some examples of each. And I actually want to also highlight that day to day, people change. It's normal to go between these zones. So that, again, if you're looking at this and identifying only with the fear zone today, but maybe the growth zone other days, that's typical. We go back and forth. So again, just a little start to our presentation. And our goal by the end of the presentation is really to kind of give you some sense of how COVID has affected people's psychological well-being, how the field of psychology overall has responded to the pandemic, and hopefully, most importantly, giving you a few strategies to improve your own psychological well-being during this difficult time.
All right, so let's talk a little bit about some of the effects of the COVID-19 pandemic. And what I want to do is try to break this down a little bit. So there are, the most obvious thing and the things that people are talking about mostly is the idea of catching coronavirus or contracting COVID-19 from coronavirus, right? And that very, reasonably so, is a huge focus. What can we do not to catch it? How can we avoid it? How can we not spread it to others? Et cetera, et cetera. The effects of that, right? In terms of psychological effects, mental health effects, really sort of center around fear, right? And isolation. So you get a lot of the fear about catching it. And then for those who do contract coronavirus or suspect that they have coronavirus, there's a tremendous amount of fear and anxiety around that. What does that mean for me? How am I going to respond? Am I going to get somebody else sick? Did I already get somebody else sick? How am I contributing? And it can spill over. And then if you get to the point of actually, contracting COVID-19 and having to be hospitalized, you're faced not only with all those fears, but you're in isolation, and you have people coming in, where they have them, and practically in hazmat suits. It's terrifying. They're literally like scenes from movies that you would see. And then the other thing is you are completely isolated. No one can come visit you. You cannot see people in person. And so there's a tremendous impact on somebody's well-being while they're going through that. But even then, for people who recover and come out, then there is the fear of, are these going to be long-lasting effects and everything, plus just the memories that you're left with. This could be truly a traumatizing kind of event. So there's a lot surrounding the illness, catching the illness, and sort of the impact of that. But that's actually probably the smallest fraction of what we deal with. So beyond that, you have the idea of close others who might catch coronavirus or contract COVID-19. And this brings about all kinds of fears about what's going to happen to them, how they're going to respond. Also, did I contact them? Was I, in contact with them when they could have spread it and it spread to me? And also, you have to distance from them. You can't go visit them. Or if they're not serious enough to be hospitalized, you have to figure out how to, if you live with that person, navigate your household in a way to try to prevent others from getting sick. As I go through this, right, it's just sort of, all of the effects are just astronomical. And that's for people who catch it and, maybe live with people or know people who are close to them who catch it. But there's also just the broader idea of what if I catch it, right? And the anxiety that comes around that. And in psychology, we refer to that sort of broadly as health anxiety, the idea of getting sick and getting someone else sick and what can happen there. That has a whole host of impacts as well that's ongoing now. And you see people sort of dealing with that in different ways for sure. But also that impacts their response to how others are dealing with it. So if you have really high health anxiety, and you live with someone who doesn't, and you now have to navigate how you're both going to handle precautions and safety, there's a lot to unpack there, right? And I'm sure many of you have been through some sense of that, either on a minor scale or a major scale, at some point. But then, like we've moved beyond the virus, right, and the disease, and you get to the pandemic, right? We all, in the span of a couple of weeks or so, went from living our lives and kind of following this on the news and wondering what was going to happen to lockdown, right? Stay at home. Don't come back to campus if you were, in school, or come back to campus. No, we were just kidding. Don't come back to campus. Maybe you'll come back next. No, you won't come back next week. Stay home for a little while. Actually, stay home for the rest of the year. You have people who lost their jobs. You have all this uncertainty about, will I keep my job? Maybe I've had to pause my job. Maybe it'll be there when I go back. Maybe it won't. I have to work from home now. I have to take online classes. I have to work from home and take online classes while also homeschooling my children and trying to figure out how to help them log on. And so you get the picture, right? We've all been living this for the last several months. And so then that alone, right, has a tremendous impact. Put on top of that you can't really engage in probably what most of us would do to deal with stress like that, right? So what do we do when we're stressed? Well, typically we either engage we get stressed, right? We freak out, all that kind of stuff. But, right, if we're trying to deal with it healthfully, and we move past that, we reach out to others for support, right? And maybe we try to engage in some kind of self-care, right? So maybe I'm going to go to the gym, or I'm going to go do a yoga class, or I'm going to go for a walk, right? And now you can't go see anybody. You can't go to the gym, it's closed. You can't go to yoga class. You can go for a walk outside, but please bring your mask and make sure that you make a wide path around people and don't get, and it's mind-boggling. So not only are the stressors just through the roof, but the ways that we would normally cope with them are taken away from us, right? And so we're left with this sort of, cocktail of terribleness that we all have to find a way to navigate, right? On top of that, we've got, for people with medical conditions or mental health conditions, you've got changes to your healthcare. You have to convert to telehealth. You're not having your regular appointments. So now you've got concerns about your chronic conditions. You might want to go get your chronic condition sort of managed, but that chronic condition might be the very thing that makes you even more likely to need to stay at home so that you avoid the chance of getting the virus. So it's, you could see all of this just compounds on itself. So now that I've thoroughly depressed you all and made you wonder how in the world you have gotten through the last several months, let me sort of talk about a little bit of what people have talked about in terms of this pandemic impact, the idea of all these policies that go on. People have talked about this as a bit of a force multiplier. So basically, if you were in pretty good, let's say, family relationships, right, and you were doing really well, and you get along with your family, you guys are, you have a tight family and everything else, and now you're forced to be home 24/7 together. There are going to be some problems, but we've heard people talking about actually, like, this has been kind of nice. We've gotten to spend more time together. We're doing more together. We're closer. We've gotten connected. And you have this sort of idea that people who are doing really well may have gotten some benefit from it. But then if you're on the flip side of that, and you're in a living situation where you are in very strained relationships, and all of a sudden you're told you guys can't leave the house. You have to stay home together all the time. that's going to really compound the strain that you have. You can't escape each other, you can't get away. And so it's this idea that, you know, things that were good, there may be some opportunity for that to be improved, but things that were bad are just going to keep getting worse. And so there's an idea that we may have kind of a split here. So all of these kinds of things were going around, and, you know, and there was an effort within a number of different fields to try to look at this. There's a group of researchers sort of internationally who collaborated to try to understand the impact on couples, for instance, and started collecting data from thousands of people across the world, you know, in terms of how they were managing this experience. My doctoral students, so I'm in the psychology department, and I work with both graduate students and undergraduate students on research, as well as teaching classes. And my doctoral students, who all have an interest in how people navigate stress and trauma, reached out and said, you know, we should really try to do a study on this and try to understand how people are dealing with it. And so we did. And so we rolled out the Coping During COVID-19 study. We didn't have any funding for it or anything else, so we just had to try to push it out as best we could, and you'll see the limitations about that in just a minute. But we put together a whole host of measures trying to understand how people were sort of responding both individually and interpersonally through the pandemic. So we ended up getting data in our first time point. We did do subsequent time points, but I'm going to tell you today about sort of the initial snapshot of about 400, almost 500 adults. They range from age 18 to 77, right? So we had people, you know, who weren't in college yet, all the way up through, you know, folks who were retired. Mostly women, about 50%, you know, were married or partnered, and 50% were either single or divorced or something. And they all of these responses that I'm going to talk to you about came in somewhere in the late April, early May timeframe. So if you think about what that means for the pandemic, right? You know, really March, right, is the month that turned for the U.S., right? You know, where we went from, you know, hey, everything's going to be fine to, oh my word, you know, the world is blowing up. And so, so we were getting people about maybe 3 to 5 weeks after that, right? So maybe we you know, we probably missed the first sort of initial, you know, panic and then settling in, and then we picked people up there, right? But what you're going to see is the way we pushed this out was really just through, you know, pushing things out through social media and people we knew. And so it went out through Mason and through people we knew, and then that spread. And one of the students in my lab, her fiance is a writer at the Atlantic, and so he pushed it out. We got some people there. So we have a sample that looks a lot like people who are into college and read the Atlantic. So what we have is a very highly educated sample. We had literally more than half of the people who had more than college, mostly white, and the annual household income you see here, you know, we had some folks on the low end there, but the biggest bar here is over 100,000, you know, in terms of the annual household income. Now, if you live in Northern Virginia, you know that, like, for this area, that's actually not knocking your socks off, but obviously, right, this is a slanted sample. What that means is what I'm going to show you is probably, if anything, skewed toward people who are doing pretty well. Right? So these are probably people with lots of resources and lots of privilege, right, to be able to sort of access things. So you're not going to necessarily see as much of an impact from the digital divide. You're not going to see as much of an impact from maybe, you know, health inequities that we know exist across racial classes and social ethnic classes or social economic classes and that kind of thing. So keep that in mind. This is probably a snapshot of who's doing well, right? So in terms of the changes that people did report, we did, you know, so a couple questions, again, just to sort of reflect this, right? We only had about 6% of people who actually lost a job, another 11% who reported they had some reduced income. And 66%, 2/3 of the sample are reporting that basically they've got adequate space for their needs for everybody who's living in their house. I'm not gonna tell you right now, that's not me. But we had, you know, one kid trying to do 3rd grade online, one kid trying to do 6th grade online, and 2 of us trying to work from home, and all of us on top of each other. We did, because the Wi-Fi wouldn't stretch and blah, blah, right? You know, not a massive problem in the grand scheme of things, but you know, I wouldn't have said that, right? So again, the sample is pretty adjusted. But we did have about 25% of people who reported that they were in some sort of high-risk category. 65 or older, you know, a specific health comorbidity that might put them at greater risk of contracting COVID-19 if they caught the virus. About 4% reported that they had been diagnosed with COVID or suspected very strongly that they had contracted COVID. 8.4% were unsure. 48%, about half, said they knew someone who had been diagnosed or strongly suspected that they had contracted coronavirus. 14% had jobs that involved possible exposure, things like healthcare workers, and 14% were living with someone who had a job with that kind of exposure. So we had a decent chunk of people who were, facing some real exposure to this pandemic. Here's a snapshot of how people sort of reported their change during the pandemic. And what you see is on the left-hand side of the screen, you've got, things that decreased a lot or decreased a little. In the middle, in the blue line, is there's no change. And then the greens are it increased a little or increased a lot. So for sleep, you see, we had a range, right? Some people reported losing sleep a little bit. A lot of people reported no change or even getting more sleep. Healthy diet took a little bit of a hit. You had people, maybe no change. People in general say, I'm not quite as good as I used to be. You see productivity certainly took a hit, right? People are not as able to be as productive as they have been. And you see a lot of increased loneliness, right? In that right-hand side. You see some no change, but people reporting a little or even a healthy number of people reporting a lot more loneliness than they had before the pandemic. So we're seeing some impacts. In this sample, we actually had about almost 42% of people who reported that they either currently had or had a prior diagnosis of a mental health disorder. And that included things like major depressive disorder, obsessive compulsive disorder, social anxiety, post-traumatic stress disorder, or a handful of others. And those are people who had a confirmed diagnosis. So we had a good snapshot of people who experienced mental health problems, in keeping with the fact that, a large percentage of people in the population experience a mental health disorder at some point in their life. And what we were able to do is to see, do people who had a prior mental health disorder experience any kind of difference in their symptoms? And we looked at this in part because early on in the pandemic, there were a lot of reports about people who had experienced mental health problems who actually felt like they were doing better. There was a popular article that was written about it. A woman was interviewed, I think it was in the Washington Post and on NPR, about how she had obsessive compulsive disorder and was actually feeling better during the pandemic, in part because she felt like everybody else was kind of doing what she normally did, and in part because she didn't feel as much anxiety about going outside and being exposed because everybody was being so careful. So we wanted to look at that, like, did we find that in our data? So what I'm going to show you is people who they reported on their depression before the pandemic and their current level of depression, and they reported on their levels of anxiety before the pandemic and their current anxiety. And what I have this split into is people who had no prior diagnosis, and they're going to be in sort of orange, and people who had a prior mental health diagnosis, and they're in green. And so what you find is that in terms of, how much depression people were reporting beforehand, certainly people with a diagnosis or a prior diagnosis were reporting higher levels of depression, but that was even exacerbated in the pandemic in terms of the depression. Now, we got the exact same pattern in terms of anxiety, to the point where not only were people sort of different in terms of their levels here, but the increase that people with a mental health diagnosis had was significantly greater than the increase in people without a diagnosis. So they started at higher levels of depression and anxiety, and they got even worse during the pandemic than people who had no prior mental health disorder. So we didn't find support for that kind of buffering effect. We found what you would sort of expect is that people who are struggling a little bit in terms of mental health are hit even harder by this kind of a stressor. And just to sort of show you, we looked at whether or not that was accounted for by their exposure to COVID. You remember I sort of tracked how much they had exposure in terms of, did they have it? Did somebody know they have it? Did somebody they know have it? Do they work in a job that, where they might be exposed to it? That actually didn't account for any of these differences, but there was one variable that did, and that was fear of COVID. We gave them a scale that assessed their overall fear of contracting the disease or of what might happen if they contracted the disease or someone closer to them. And that alone accounted for the entirety of that difference. People with a current diagnosis or a prior diagnosis had higher fear. And when you broke that down, you can see basically these graphs basically show you, like, if you have low fear of COVID on the left, you've got kind of low change in depression and a low increase in your anxiety. And then as you go along the graph toward the right side of high fear of COVID, the change, and this is change in your depression and change, and that should say anxiety on that second graph there. It says change in depression twice. Both of those are increasing sort of right along with that. So what we basically find is that people with, who had already had some struggles with mental health problems had a little bit more trouble during the pandemic, and most of that was accounted for by their fear of COVID. So we found we looked at a lot more than that. The folks who took our survey will tell you we looked at a lot more than that. The surveys was long, but I kind of want to just give you like a little snapshot here of what we what we did, what we found, and I'm happy to when we wrap up take any questions about what else we're looking at in here and everything else. But this is a little bit about what we did. And I'm going to turn it over to Dr. Mehlenbeck now to sort of talk some more about how psychology is then addressing all of these issues that we started to tap into.
Yeah. So thanks, Dr. Renshaw. When I'm going to talk just a little more broadly, about the idea of addressing mental health challenges during a pandemic. There's a couple of different areas that I think about when we're talking about this. The first, which I actually think Dr. Renshaw summarized very well, is just recognizing what are the concerns, because they do range from the direct impact of the pandemic, of COVID-19, to things like isolation and loneliness. And this clearly, some of the data is showing that it differentially affects people who were already struggling with mental health issues prior to the pandemic and then after. But there are a lot of different concerns that different people will have. Some people, I've heard, because they have too much time on their hands to worry. And so that you end up having more fear and more anxiety because they're bored, versus other people who are working so much, whether they're in essential positions, whether, whatever they're doing, that they actually don't have any downtime at all to do some of the self-care. So again, recognizing what the initial concern is can vary across people. Essential workers, when we define essential workers, we think about our doctors, our nurses, our healthcare workers, our frontline providers, our emergency professionals, but we also include our grocery store clerks, anyone who basically has to work despite the fear of the pandemic and despite whether they want to or not, for a lot of reasons. And so that is a whole other area of addressing mental health challenges that we need to think about as we're moving forward. And I would absolutely it would be awful if we didn't mention the health disparities. There is no question, there's data coming out. We know very clearly that minority populations have been disproportionately affected by COVID-19, both the physical effects, those who have gotten sick, the numbers of percentages of people who've gotten sick from COVID-19, the deaths from COVID-19, as well as the fact that a lot of our underrepresented minorities are overrepresented in the essential worker and I guess what they call the, I'm forgetting the name of it, but like our Uber drivers and our Uber Eats folks. I mean, the folks that have to work to be able to make things happen day to day, not the majority of the people that were actually in Dr. Renshaw's study. So again, when we're thinking about the mental health challenges, we also have to think about how the COVID-19 affects people from different backgrounds in different ways. Next slide. So I wanted to take another step back. Psychology as a field has responded in a variety of ways. One of the best resources for thinking about different ways of response is the American Psychological Association. They have done an incredible amount of advocacy on behalf of mental health, provided resources that are trustworthy for the public and for providers. They've also done quite a bit of advocacy to make sure that telehealth is more accessible to more people. And that is really critical right now when you can't get to a mental health provider in person. And so the idea of telehealth being accessible to everyone is very important. The APA advocated to help relax the rules around telehealth. We're sitting in our homes and doing therapy and treatment at times, okay? In non-pandemic times, that would never be allowed due to privacy and confidentiality concerns. Now there are very specific guidelines about how to do that, to be in a private area, to use headphones, to try to do all that we can to protect the client's confidentiality. But it's more important that we're able to help our clients than say, okay, well, just because you're stuck at home, you're not allowed to do this telehealth. I also put on a resource, the National Center for the National Child Traumatic Stress Network. Even though it's child focused, it has some tremendous resources for dealing with trauma, both for healthcare providers, essential workers, and for the general public. And that is really important for everybody to have those type of resources. Most of the major organizations have put out resources around the mental health for kids, for adults, for those with previous diagnoses. And then also, psychology has responded well to provide support for the mental health providers. If we think about how all the mental health providers are really working overtime in some ways to make sure that others around have the support they need, then there's the question of, well, who supports the mental health providers? And again, so that is something that I do feel psychology has done a reasonable job of responding as a field. Next slide. All right, so this is, I think, where, it's really important to think about your own psychological well-being. Those of you who are getting ready to go to college, who've had your senior years of high school disrupted, those of you already in college who have had, your college courses, your time with your friends, your activities, your sports disrupted. It's really important to make sure you're focusing on improving your own psychological well-being as well. I think about so many of our college students who've now gotten stuck at home with their families right at a time when really developmentally, appropriately, you want to be independent. And how do you balance those? And so many of the psychological issues that I think really that college students struggle with do relate to that social isolation. And we're going to talk more about that. First, though, I always recommend getting back to the basics: sleeping, eating, and then getting some physical activity. This is another one of my favorite infographics. You'll see a lot of my infographics, but it's very easy when you don't have a regular schedule. You're not leaving to go to class, you're not leaving to go to work, or you're stuck going to work and worried about all of the things that come with that, for your sleep to be disrupted, for you to become unhealthy, more unhealthy in your eating, and that includes drinking. Lots of social media gifs and jokes are around how much everybody is eating and drinking right now, to cope with the pandemic. So, if you're struggling with anything mood related, going back to the basics: am I getting 8 to 9 hours of sleep? Is it uninterrupted? If not, then there are some things you can do to address sleep. Am I eating relatively healthy? Again, doesn't mean that you have to be, a health conscious, very rigid around healthy foods. We all like treats. But if you're the person who's drinking a lot, a bottle of wine a day or more, as well as only surviving on chocolate or ice cream, you may want to think about how that's affecting your mood. And then getting some movement, exercising in some way, despite the fact that, as Dr. Renshaw mentioned, our regular routines are not there. Going to the gym is not necessarily advisable right now for somebody who is in a high risk condition, or you just may not feel comfortable going, or it may not be open. So thinking about other ways to exercise. Another basic is connecting with others. We always talk about social distancing right now. And there was initially early on, as COVID-19 really spread, a push to try to talk about that as physical distancing instead of social distancing. Somehow that never caught on, and we still hear social distancing. The question, and I challenge each of you, how do you connect with people, your friends, your family members in a healthy way while maintaining physical distance? And while we're in the summer, while we're, with decent weather, the data supports that we can be outside, physically distanced, but still able to talk with each other, have a picnic, do things that are connecting you with others. And that is where screens do come in as well. Having Zoom happy hours was very big initially until everybody got tired of Zoom. But, having weekly family Zoom check-ins, somehow connecting with your friends. One of the interventions I have actually really recommended is FaceTiming with your friends on a regular basis, making sure that you're not just texting, but actually connecting with people and seeing their faces. And again, doing that for a week really has improved mood. Gratitude practice, there's strong data that expressing gratitude actually improves your mood. And so one of the things you'll see in another infomatic is that just doing a gratitude journal, writing down 3 things a day that you're grateful for, even if they're small things. Sometimes they're big things like, okay, the storm passed us, so it didn't knock my Wi-Fi out in the middle of a lecture. But it could be even small things of, we had a really enjoyable lunch today, or, whatever it might be. Writing 3 things a day over a week to 2 weeks improves your mood. And last, I just want to highlight utilizing social media with intention, especially with all of the time that we're spending on screens these days, and the importance of the social connection, which often happens with screens. I think we each have to be very aware of how we're using social media. It's very easy to get sucked into Twitter and totally get depressed at the state of the world, the stats of COVID, this state's shutting down again, this state you can't travel to, the political piece, it's one thing after the other. And if you don't limit kind of the passive social media, it can strongly affect your mood. So thinking about intentionally, when am I going to engage? Am I going to do funny faces on Snapchat, which I have learned to do from my teenage daughter during this quarantine period, and keep up some snaps with funny faces? Okay, it's silly, but we all laugh about it. Okay? Makes me feel a whole lot better than if I spend a lot of time on Twitter these days. Okay, next slide. Okay, so if you don't remember any of those things, download this as your daily quarantine or COVID questions and do it once a day, the beginning of the day, the end of the day. What am I grateful for today? Even if you don't do 3 things, pick one. Who am I checking in on or connecting with today? Sometimes it really is just checking in on a family member, and that connection can help you feel better. I don't know how many of you, being experts on technology, have helped older relatives figure out how to do Zoom. And, I can say spending an hour and a half trying to talk somebody in another state through setting up Zoom can be very frustrating, but also very gratifying, because the happiness that they can then connect with people is really strong. Number 3, I always love. What expectations of normal am I letting go of today? And this one, I think, helps really deal with that uncertainty of everything that changes day to day. I expect to get up and go to the gym before I go to work. Well, that's not happening right now. Okay, that expectation is gone. Well, without that gym time. I'm not getting up to go do my walk in the morning. Okay, got to figure out a new normal. When else can I get my walk in for the day? Which leads to number 4, how am I getting outside today? Again, getting outside, getting some sunlight, some nature helps tremendously with mood. How am I moving my body? The more you can move, again, there's some natural endorphins that come from movement. And then number 6, what beauty am I either creating, cultivating, or inviting in today? I have one friend who every morning when she goes on her walk, she's made a practice of taking a picture of some flowering bush, flower, something beautiful that she's noticed on her walk, posts it to the Facebook, and shares it for other people to use for maybe a morning meditation or just a morning smile. Okay. And then I also wanted to highlight the American Foundation for Suicide Prevention has some incredible resources as well on their website. And you do not need to be suicidal to go there. These are great resources, I think, for everybody. This one is another one of my favorites, Self-Care Strategies for Resilience. Again, they start off with a gratitude journal. The data supports it. Preparing your favorite food, even if it's unhealthy. Lots of us have been baking a lot. And again, you can feed your neighbors, just leave it on their porch. You don't even have to see them. Make your space comfy and cozy. And again, think about what that means for you. For some people, that means having certain things around that they get a lot of comfort from. For others, it means cleaning up and organizing. So it really depends on what you feel is comfy and cozy. Video chatting, they even say set boundaries with your media consumption. Music is a very wonderful thing to share that can kind of help improve mood too. All right, but all of this leads to, we are in a pandemic. We know that the anxiety is higher. We know that rates of depression are higher. Some of it is normal for all of us, but how do you know when to seek mental health treatment? When you have increased distress around whatever symptoms are happening, that's an appropriate time to at least get a consult, okay? Somebody can let you know, is it normative? But if you're distressed, get a consult. Very clearly, if you have decreased functioning, if for whatever reason you're not able to get out of bed, all of us, as Dr. Renshaw showed, even people who potentially are have the most privilege, show a decrease in productivity. So that's different. You know, again, we're not going to get everything done when you're trying to work, take classes, take care of family members, connect with friends. You're just not going to get it all done. But if you're not even able to function basically, you're not able to take care of yourself, you're not able to make lunch, you know, that is a big sign that maybe you should get a consultation with a mental health provider. I also want to say, if anybody does have thoughts of wanting to hurt yourself in any way, or thoughts of suicide, that's an immediate call to get a consultation. Please don't wait on that. Okay. There are many telehealth options. This actually increases accessibility for many. So our center, the Center for Psych Services, we shifted to telehealth very quickly in March. And between March 18th and June 30th, which is the end of kind of our academic fiscal year, we saw 118 clients and did over 775 teletherapy sessions. Okay, we actually saw that people who chose to stay with the teletherapy or start with it actually were more reliable, had fewer times when they missed sessions, probably because they had some more time, but also they didn't have to travel. No DC traffic. You know, that's great. Okay. There are lots of options. The other thing, we're talking about all this telehealth and these screens. We know that there are health disparities in that people don't have access to Wi-Fi or devices. And there are resources at this point that anybody who needs a device or Wi-Fi, we should be able to connect you to the proper resources, whether it's through schools, whether it's through emergency funds at the college, whether it's through county or state options. So again, right now during this period, it's critical that people have a device and have access to Wi-Fi. Next slide. So for Mason, if you guys are all Mason students, I really want to make sure you're aware that Mason has their own counseling center, the Counseling and Psychological Services at Mason. It's different than the community mental health center that I talked about. And they have a new program now that there is 24/7 crisis support. So this is the website you can go to, caps.gmu.edu. Any student is eligible for a consultation and intake, in-state or out-of-state. If you are out-of-state, they will work with you to find somebody and find resources in your state. But please, 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 if you're having difficulty, contact, and you're a Mason student, contact the counseling center. And again, they have a protocol crisis counseling program. So after 5 p.m. or on the weekends, you call the counseling center and they will connect you directly with a crisis counselor. Then of course you have our center, the GMU Center for Psychological Services. Yes, the names are confusing. We are different. We do sliding scale, as I mentioned. We also have a list of additional COVID resources that include some social services resources and more some things around, like if you're undocumented or if you need Wi-Fi and devices, there's some resources on the website for that. Last, if you're a community member watching this later on, another resource in addition to our center, because remember we serve the whole community, sliding scale, so that means we're much more affordable, but you're still getting the top-notch treatment, is Psychology Today, Find a Therapist. And we just encourage you to use filters that include insurance. We often really encourage for depression and anxiety to start with somebody who does cognitive behavioral therapy, and then you can always filter your location. Okay. All right, we also were told, okay, I'm doing okay timing, the getting involved in psychology, and I'll invite Dr. Renshaw to jump in on this too, but we have lots of ways that undergrads can be involved. We do a lot of research in the psychology department across many areas. Dr. Renshaw and I both happen to be in the clinical psychology area, but there is applied developmental, human factors, IO. I'm missing
Cognitive
clinical, yes. And so lots and lots of different areas in psychology. Dr. Mike Hurley kind of is one of our gatekeepers to the different research labs, but you can always contact psychology faculty directly. We also have the Oscar program through the university, and many of our labs have Oscar research assistants. And what that means is if you are eligible for federal work study, you can go online and find out, and I believe it's Handshake is the email. And we're actually, if anyone's interested in pediatric obesity and you're eligible for federal work study, we are recruiting 2 Oscar research assistants that you can actually get paid through your federal work study and get research experience at the same time in the area you're interested in. We have our psychology club at Mason, so I did put the link to that. Mason also has the Center for the Advancement of Well-Being, and while they're not in the psychology department, they are in our college, and they have a lot of resources and ways for undergraduates to get involved in increasing well-being. Several of us in psychology have worked collaboratively with the Center for the Advancement of Well-Being, including developing resilience exercises, lots of stuff. I would definitely check that out. They offer free meditation, free yoga classes, a lot of different things. And then through Psychology Back in Psychology, we have several community practicum courses where you can get hands-on experience. Dr. Hurley teaches the psychology in the community. And then at our center, we actually have a practicum where you get exposure to working in a community mental health center. I will say that class is full for the fall, but we will be, you can look for the recruiting advertisement to come out for the spring class.
And I will just piggyback on a little bit of
Yeah.
that and say that, well, first I'll first, before I piggyback, we'll
You want me to finish that up?
Yeah, go
so
for it.
We threw this in because it's just one of my favorite quotes. When I was a boy, except I wasn't a boy, but you know, this is from Mr. Rogers. When I was a boy and I would see scary things in the news, my mother would say to me, "Look for the helpers. You will always find people who are helping." And remember, that doesn't necessarily mean professional psychologists, social workers, therapists. You know, all of us are helpers, whether it's with our family, our friends. You know, connection is pretty critical. And if you're struggling, look for the helpers in your world.
So I will piggyback on there before we jump in, if that's okay. And I will say, first of all, if you are looking for a class that is not full and you have been interested in what you have been doing, I need to figure out, let's see, share screen, Here it is. Just to let you know, we are sort of creating over the summer this course on basically the psychology of COVID-19. We have done it in a way where we are having a bunch of different faculty members contribute individual lectures to this class. It's going to run online. And then it's being run by Dr. Erin Murdoch, who is one of our preeminent teachers, and it's being coordinated by her and Dr. Tim Kirby, whose email address you see on here. And it literally is going to go through and talk about all the different elements that where psychology sort of applies to COVID-19, things like how the public health messages have gone out, risk communication around that, the psychology of masks, right? You know, I mean, we all know how that has just taken off in this day and age, and trying to understand the different push and pull on that front and how it became sort of an identity statement, and all kinds of things here. As Dr. Mehlenbeck mentioned, we have a host of different programs from neuroscience to clinical to developmental to industrial organizational, how things impact your work, et cetera. And human factors, sort of how people interact with technology. That's obviously huge right now, given that that's how we're all connecting with people. So anyway, so if you have some interest, it is designed so that you could take it without having ever had a psych class before. So it's going to involve some intro stuff to sort of get you, you know, sort of there. But also if you've had a bunch of psych classes, it also then applies things that are specific from psychology to the pandemic. And so if you've had more, you'll be able to focus a little more on the applied side. If you haven't, you'll be able to sort of learn some of the basics and also see how they apply every day. So, and definitely if you're looking for research stuff, we work with Dr. Ushers and, you know, and Oscar a ton in psychology. We have over 30 different sort of research labs that are doing different things in our department, and we love to get undergrads involved. So, you know, definitely feel free to reach out and check that out.